Welcome to the EADV podcast. In today's episode, Professor Dede Murrell, head of the Dermatology Department at St George Hospital in Sydney, with an academic appointment at the University of New South Wales, as well as additional roles in Europe, the UK and the US, takes us into the fascinating world of autoimmune blistering diseases. She is joined by her guest Ailin He, a medical student whose groundbreaking research was recently published in the JEADV. But before we get into that,
did you know the EADV started in 1987 with 21 founding members and has now grown to over 11,000 passionate advocates for patient care in dermatology and venereology? We are a diverse community with members representing 125 different countries. If you would like to learn more about our membership benefits, or if you wish to join the community of like-minded professionals, go to EADV.org.
In their article, He and Murrell present a multi-country study involving 139 patients, shedding light on the prevalence, risk factors, and recovery patterns associated with these diseases. Together, they discuss steroid-induced myopathy, a frequently overlooked complication of prolonged glucocorticoid use in dermatology. Tune in to discover insights into the innovative glucocorticoid toxicity index.
As many of you know, one of my passions in dermatology is autoimmune blistering diseases. And our university, UNSW, has a special program whereby medical students in their fourth year of 6 years can choose to spend 6 months of their academic year with a supervisor working on a particular project. Some years ago, I worked with a rheumatologist called John Stone at Mass General Hospital, Harvard University, and 17 other specialists in different fields of medicine to create a score called the Glucocorticoid Toxicity Index, or GTI. And we have been using the GTI in our blistering disease clinics on a routine basis in order to determine the toxicities caused by steroids. This past year, the student who joined me was Ailin He, who's with me today on the podcast. And I'm going to be interviewing Ailin about the project she just published in the JEADV, looking at steroid myopathy in our blistering disease patients. Ailin, could you say a little bit about why steroid myopathy is important and interesting to you?
Thank you, Prof, and thank you for this opportunity. Now, glucocorticoid-induced myopathy is an established complication of steroid use, and it's something that affects our patients and is often the first sign that they complain about, and it really affects their day-to-day life. Unfortunately, however, after searching up glucocorticoid-induced myopathy, having heard about it for the first time, I was really surprised to see that there's actually not that much on it in the dermatological field. And muscle weakness is predominantly only measured in rheumatic or respiratory disease patients. And because patients with autoimmune blistering diseases are often on quite high doses of steroids and for long periods of time, we thought it was very important to explore glucocorticoid-induced myopathy, not only to draw more attention to it, but also identify potential risk factors that could improve patient outcomes.
That's right. Now, with this project, we had 8 different colleagues in 8 different countries who were helping us out with this project as well as other projects. And we'd like to acknowledge their contributions to the work that is coming. And so I can mention in Greece, we had Katerina Patsatsi. In Japan, and in Turkey, we had Sona Uzun. We had Donna Colton in the United States, Mariam Danish Pazu in Iran. Ailin, help me out here with these flags. I haven't got all their faces in front of me, but it's definitely a group effort. Here are the other co-authors. We had Dr. Takahashi and Dr. Kakuta in Japan, Dr. May Ramirez Quizon and her team in the Philippines. And we had a team, Baoqi Yang in China. He recruited a big number of the patients. And then we had a number of my fellows involved in the project. So each of us was recruiting patients who had either finished steroids as a control group, people who were still on steroids, but who stopped them during the follow-up period, and compared those with people who were maintained on steroids, and then looked at the steroid myopathy as they came off steroids or decreased their doses. How is the GTI measuring steroid myopathy, Ailin? Can you explain that?
Of course. So as you mentioned, the GTI, or glucocorticoid toxicity index, was developed by a team of 17 clinicians, one of them being Prof. Murrell herself, and it represents 11 different specialties. Now, the instrument measures a change in glucocorticoid toxicity over time using two different scores, the GTI cumulative worsening score and aggregate score. And essentially, both of them are looking at changes in toxicity compared to your baseline. And it measures using 9 domains, including metabolic, dermatological, psychiatric, and other domains, and one of them is steroid myopathy. So myopathy is measured using two things on the GTI. A questionnaire is first used to measure the impact on day-to-day life. And so we ask patients 3 questions. Firstly, have you noticed any weakness to your thighs or your shoulders in the past 3 months? In the past 3 months, have you noticed any difficulty lifting your arms above your shoulders? And finally, in the last 3 months, have you noticed any difficulty getting out of bed or climbing the stairs? And this is because we know that glucocorticoid-induced myopathy predominantly affects our proximal muscles, so especially our hips, pelvic girdle, and shoulders.
So after those questions, then it involved examining the patients, didn't it? And we were there's a training video that John Stone provides if you're not sure how to do this. And we weren't sure if there should be some validated instrument that you could use to measure it. But it turns out that there isn't really a validated instrument such as a dynamometer, which we did try, but it's not as easy to use as you'd think. So do you want to explain the 3 different myopathy grades and how that worked, Ailin?
Yeah. So in terms of the physical examination, that's graded using the Standard Medical Council rating scale. And so we measured, we scored muscle weakness based on that, and then graded myopathy either mild, moderate, or severe. So mild was a grade 4 with no functional limitation. So they answered no to all 3 questions. Moderate would be a grade 4 with some functional limitation, and severe is a grade 3 or below.
Mm-hmm. And so these patients had to come for how many subsequent visits? Do you have to include these autoimmune blistering disease patients to make it into the study?
So part of the inclusion criteria was all patients had to complete 1 baseline visit and 2 subsequent follow-up visits at least 3 months apart.
Mm-hmm. And so from these various countries, you were the one collecting all the primary sheets and then uploading them into the Steritas GTI software so that there weren't any transcription errors. And then can you explain in terms of results how many patients were included, men versus women, ages and stages, please?
Sure. So the study in total, we had 245 patients, but after the inclusion criteria, we eventually had enrolled 139 patients. And this was a combination of retrospective and prospective data over the 4-year period. And now in terms of the patient demographics, we had So 77 males and 62 females, and a range of ethnicities. So Caucasian made up 10%, East and South Asian 38%, Southeast Asian 3%, Southeast European 14%, Middle Eastern 31%, Latino 1.4%, and African American 0.72%. The mean age was 50 years, and we had a mean BMI of 26.2 kilos.
And I had that there were 462 patient episodes over 371-day median follow-up. Is that right?
Yeah.
And then how many patients developed the glucocorticoid myopathy at some point during the study?
So over the course of the entire study, nearly half of our patients, so 47.5%, developed myopathy. And so this shows just how common steroid myopathy is.
And how was it breakdown between mild, moderate, and severe among those?
So we had 94 episodes of mild cases, 36 moderate, and 3 severe cases of myopathy.
Mm-hmm. And how did you analyze the risk factors? What method did you use with the statistician at UNSW to look at the data?
So in order to measure the risk factors, we used a multivariate ordinal regression, and this generated a forest plot which allowed us to identify the risk factors. And so I can explain the risk factors that we found. So we found that age, especially between 50 to 65 years old, male gender, a high BMI, and cumulative dose of steroids were major risk factors for developing myopathy. And we found that especially doses above 0.75 milligrams per kilo per day would increase your risk of developing myopathy by 3-fold. So that's quite significant.
And you mean over a cumulative period of time, not just a week of a high dose of steroids, you mean an average cumulative milligram per kilo per day dose, is that right?
Exactly. So consistent with previous studies on glucocorticoid-induced toxicities, we know that cumulative dose rather than average dose and treatment duration is what is the risk factor for developing these toxicities.
And did these patients who developed the myopathy have any other associated side effects as measured with the GTI?
Yeah, great question. So we found that over 95% of episodes were associated with at least one other side effect. So that included metabolic, dermatological, and psychiatric.
Mm-hmm, mm-hmm. And why is all of this important? What are the take-homes for us as dermatologists or GPs? Why bother doing all of this?
I think that this study is really firstly a wake-up call to pay more attention to steroid-induced myopathy. I think quite often we forget about it, especially when we're so focused on the disease at hand. And we know that particularly with AIBD patients who are often more elderly, the effects of muscle weakness are profound and really does affect our patients' quality of life. It increases the risk of falls and also difficulties with day-to-day living. And I think that we know how common and how impactful muscle weakness is. And so we know that we need to reduce cumulative doses. And so that's not just, as you said, about how much you're taking in the short term, but it's how much patients are receiving long term. And so we suggest minimizing cumulative dose and also exploring potentially other steroid-sparing therapies such as rituximab. And I think that given that most of the episodes of muscle weakness are associated with additional side effects, it emphasizes the need of incorporating a multidisciplinary team for our patient care, helping them to better reduce the treatment side effects and disease burden. So simple things such as recruiting physiotherapists and installing shower railings and things like that. So I think that's why the study is important.
So in terms of the good news in this study, what did you find when the patients either stopped steroids or the doses were reduced? Was there any reversal of this myopathy?
Yeah, so the good news is that most patients in our study did experience an improvement in symptoms, and that correlated with a decrease in their cumulative dose.
How long did it take before you could document a minimum clinically important difference, i.e. greater than 10 decrease in the scores?
So in our study, it took a median of 107.5 days for patients to have an improvement in symptoms. And we had 28 patients who actually had their myopathy completely resolve. And so of these patients, 5 had stopped steroids and 21 had reduced their dose.
Do you think that longer-term follow-up's needed, or does this study provide all the answers? Do patients need to be followed for more than a year to see if they ever get back to normal muscle function?
Yeah, definitely. I think that would be useful. We did find that in our control group so all the patients who did not receive any steroids during the study, none of them had muscle weakness. And so I think it would be really beneficial to see whether or not this occurs in our patients that we found in our study to have myopathy and how long it takes for their myopathy to completely resolve.
The ones that were control group, they were people who previously had steroids, weren't they? And how long before they began being in the control group, roughly, had they been finishing those steroids? Do you remember?
Yeah, so it was difficult to measure, but roughly we said that a median of 108.5 days was how long they had stopped steroids for.
Oh, okay. So then but then the ones who'd stopped steroids during the study had passed that time point, but many of them still had the myopathy, didn't they?
Exactly. So I think this highlights just how variable the improvement can be. And we did find that there was a huge range. So even though the median number of days was 107, 108 days, it ranged anywhere from 45 to 189 days. And so we know that it's highly individualized. And like you said, we don't have all the answers yet.
Do you think that doing some proactive exercises would be a good idea in our patients if they're capable of doing that?
So there have been studies that show exercise can help improve muscle weakness. And so I think that it would be really beneficial to have future studies looking at the effect of exercise, and this will provide potential management or intervention strategies to improve muscle weakness.
I'm just hoping one of these days we'll get some more drugs, not just rituximab, other medications coming through our clinical trials that mean these patients can get off these steroids sooner, or possibly if they're caught early in the stage of the disease, maybe they won't have to have steroids at all. That's my hope. And so, well, thank you, Ailin, for giving up your evening, especially here in Sydney on a long weekend public holiday. And keep up the passion for dermatology and blistering diseases. Thank you for the time and for your spending the year with our group. Thanks.
Thank you so much, Prof. It's been a pleasure.
Thank you for listening. And if you haven't already, please make sure you subscribe on Apple Podcasts, follow us on Spotify, or otherwise you can find us on any major podcast provider. We appreciate you joining us and look forward to presenting more interviews on other important topics. If you're a regular listener to our podcast, we would love to hear from you. Your feedback will help us improve the show and develop episodes that you're interested in hearing. To participate in the short survey, simply follow the link in the show notes of this episode. Thank you for your support. It means a lot. Until the next episode, take care of your skin.